Gynecologic oncology is a very unique specialty. I am passionate about this care because I've discovered women with cancers are the bravest patients I know. They're very motivated in fighting their cancers. And these are patients who represent our mothers and our sisters and our daughters and our wives. So I'm very passionate about delivery of care for these patients. I'm a board-certified gynecologic oncologist. We're a very low-density subspecialty that delivers care for women afflicted with gynecologic malignancies. And this encompasses both extensive surgical intervention, making diagnosis of suspected cancer, surveillance for recurrence of cancer, deliveries of chemotherapies, and to actually take care of patients also in their end of life, if required. So we're one of the few surgical oncology specialties that does everything for a patient. With cancer, genetic testing has become paramount in the age of what we call personalized cancer care. Not only does it describe the risk for cancer within a family or a family grouping, especially for relatives of that patient, we're now discovering molecular targets from genetic testing. And this allows, in the age of directed therapies, where we're having very special medicines that can attack the cancer cells directly by damaging its DNA or other components of its cell life. So these are extreme benefits for patients today, where 10 years ago, there was maybe very little hope for patients who had recurrent diseases in the world of gynecologic oncology. The role of genetic testing also spans across all malignancies. So where we used to confine our research to very specific diseases, such as ovarian cancer or endometrial cancers, we now realize that there may be a common pathway or a common vulnerability with cancers based on their genetic makeup. We recognize that treating in a silo of ovarian cancer or even just gynecologic cancer is really not very effective. So having a comprehensive cancer care center will really place all cancers under one roof. We will be able to cooperate with my colleagues, like in radiation oncology, medical oncology, looking at all our malignancies to make sure that if there's any common goals for treating these patients, common therapies that are available. But even more important, going beyond the medical aspect, it's very critical for patients with malignancies that we recognize there's an entire system that needs to be energized. Support services such as nursing navigation, which can help patients navigate through this very complex conflicts they have when they're confronted with a cancer diagnosis. Recent studies have shown that when you're speaking to a patient about a cancer diagnosis, they probably hear about 25% of what you speak of, and that's why it's important that there's a nurse navigator with me. We have financial navigation. Cancer is toxic not only to the body, but to one's financial well-being. It can be devastating to a family. We recognize that. We have energized those resources. So coming under one roof under a comprehensive cancer center will synergize all those resources to make it even more effective in the delivery of care for patients with cancer, whether it's gynecologic or other types of cancers. I think the future holds tremendous promises in the next 5 years, in the next 10 years. Cancer will not go away. It doesn't care if you're a young mother or a grandmother or a daughter. It affects everyone equally. But having the resources here under one roof, having the resources available in terms of the delivery of care for patients with cancer, the medical care, the surgical care, the psychological care, the financial care, that is all recognized by the First Health Organization, by Moore Regional Hospital. I think we are dedicated to that now, and that dedication will just be massively increased in the next 5 to 10 years. A comprehensive cancer center will just be an important landmark for that, but it will symbolize our ability to deliver that care, and as a beacon for all patients with malignancies in this region, that they will have a place of hope and a place of effective care for them.